Massive bleeding leads to hemorrhagic shock with organ failure. It is difficult to diagnose hemorrhagic shock because compensatory mechanisms are able to maintain blood pressure for some time. Reflex tachycardia is an excellent warning sign. The trauma triad of death is a combination of coagulopathy, hypothermia, and acidosis. It constitutes a vicious circle. If it is not broken, exsanguination results in death. Taking steps to stop bleeding as soon as possible directly on the field is called remote damage control resuscitation. Early hemorrhage control is a constant goal in the management of a massive bleeding casualty. To stop hemorrhage from the limbs, tourniquets are applied. Stop bleeding from the wounds involving the face, neck, torso, and groin using hemostatic bandages. Traumatic coagulopathy sets in rapidly. There are two approaches to preventing acute traumatic coagulopathy: administering hemostatic agents and transfusing blood products, like plasma, containing clotting factors. The best hemostatic agent, tranexamic acid, to be administered as soon as possible. The easiest and earliest way to transfuse plasma is to use French lyophilized plasma. The goals in reversing traumatic hemorrhagic shock are reaching permissive hypotension, a systolic arterial pressure above 80 millimeters of mercury, unless associated with a head injury above 100 millimeters of mercury. The goal of low-volume resuscitation, rapidly reinforced with vasopressor support, is to limit the following: dilution of clotting factors, hypothermia, hyperchloremic acidosis due to infusion of saline solutions, cellular edema, which increases the risk of acute respiratory distress syndrome, organ failure, and death. Transfusion resuscitation is a key goal. It is based on setting up a protocol for massive transfusion. Massive bleeding must be remedied by rapid, massive transfusion with red blood cells plasma containing clotting factors and platelets. Hypothermia must be prevented during pre-hospital care. Reduce exposure to cold. Stop external bleeding rapidly. Cover the patient with a warming blanket and warm fluids. In civilian setting, hemorrhage is the primary cause of preventable death. The concept of damage control has become the gold standard in battlefield military medicine and is now routinely applied in civilian practice. Damage control resuscitation involves individual indications: massive hemorrhage, acute traumatic coagulopathy, stabilizing a severe trauma patient, and collective ones, mass casualties incidents. Integrating damage control resuscitation into an overall strategy, including remote damage control and damage control surgery, significantly improves the survival rate of the most severe trauma patients.